when we have irritable bowel syndrome, we have typically symptoms of bloating, belching, reflux, um, increased gas, just a lot of discomfort, especially after people eat, right after a heavy meal. And it usually happens pretty like within 20, 30 minutes, and they actually look like they're pregnant, and they're like, what's going on over here? And this is typically what we call small intestinal bacterial overgrowth, or you'll hear the acronym mostly pronounced as SIBO. SIBO. And what SIBO practically is, it's a overgrowth of bacteria that should not be in the small intestine that actually set up shop there. These are basically bacteria that normally live in the colon, and for many reasons, they end up staying in the small intestine and causing all kinds of havoc. The small intestine is meant more for your body breaking down the food and processing it and absorption. And when we have, this abnormal bacteria in the small intestine, they cause all kinds of problems. And typically what we end up seeing is that when we have certain types of carbohydrates in our diet, these bacteria start fermenting these carbohydrates into different types of gases, and that's what we see with all the bloating and gas that people get after they eat. And this comes sometimes in two different flavors. Sometimes it comes with irritable bowel syndrome with diarrhea or irritable bowel syndrome with constipation. So you could have both. Some people actually have both types of things. Some people have more predominant diarrhea type symptoms. Other people have more constipation type symptoms. And a lot of it depends on what we're going to see with the testing that we can do with to see if somebody has small intestinal bacterial overgrowth. And so we kind of dealt with some of the symptoms and what SIBO is, basically an overgrowth of bacteria, fermentation caused by the bacteria in the small intestine that shouldn't be there. So generally, what causes SIBO? SIBO typically happens when people have slow motility of their gut, and this can happen a lot with diabetics. Just how they get neuropathy or damage to the nerves. You can get damage to the nerves that cause what they call peristalsis. It's basically movement of the small intestinal contents all the way down to the colon. And if that sometimes is slow due to things like diabetes or low thyroid or low gastric acid. A lot of people don't realize, but nowadays people take a lot of acid medicine, medicine to drop the acid for reflux or, and that low acid, your body needs to break down food for it to be able to get, and basically the acid is what stimulates the pancreas to release pancreatic enzymes to break down the food. And that generally happens in the duodenum, which is the first portion of the small intestine that comes right after your stomach. And if we don't have the stomach acid, you're not going to have release of pancreatic enzymes, and you're not going to get breakdown on these foods. So now you have these foods that haven't been broken down. And if you have small intestinal bacterial overgrowth, these bacteria are going to start breaking down these foods, into things that shouldn't be broken down to, or start fermenting these foods, especially the carbohydrates. And that's where you start getting this bloating or gas. So basically low acid production in your stomach, which we need for digestion and breaking down food. Problems with your pancreas, not producing enough pancreatic enzymes, which generally happens as we get older. We produce less gastric acids and less pancreatic enzymes. So sometimes we need to add those to our regimen, help people digest their food better. And the other thing is poor motility. So you're basically not sweeping these bacteria into the colon. They're just staying there, So we need things to help, push things along. And sometimes people have problems because that's, they're just, small bowel is very slow, Sometimes this small bowel too could be from medication. Sometimes people take medicines for pain, and those medicines slow down the transit. It sort of like hijacks the normal, what we call peristalsis, controlled movement down the small intestine, sweeping everything down. So that is another reason why you can get SIBO, or small intestinal bacterial overgrowth. And typically, there has been a real big association through a lot of studies nowadays, with SIBO and certain chronic conditions. And there's been a correlation of almost 80% of people with fibromyalgia end up having SIBO. And one of the reasons why that happens, I believe, one of the hypotheses is because with their having SIBO, they're not getting all their nutrients. They're not getting all their vitamins absorbed because it's not, the bacteria are kind of messing that up. And they end up with nutrient deficiencies. And fibromyalgia basically is a nutrient deficiency. Your muscles are starving for energy, for nutrients like B vitamins and amino acids and things like that. Another condition that's really highly associated with SIBO is diabetes. We kind of talked a little bit about that already because of the poor motility, and patients with diabetes have a lot of issues with gastric emptying. The other thing is obesity, especially because now they're saying that obesity is tied in with dysbiosis, abnormal bacteria in your gastrointestinal tract or your microbiome. Obesity has a lot to do with the bacterial makeup of your microbiome. If you have certain types of bacteria, which they call them firmicutes instead of bacteroides, those people tend to have more weight gain because these bacteria, they kind of hijack all the nutrients and for themselves and don't give it to the person, and their metabolism slows down. So there's a lot of studies now where they're actually doing stool transfers, from a fat person, skinny person to a fat person. They start losing weight. So they're bringing in the microbiome from the intestinal makeup, through capsules, into the skinny person, and they start losing weight. So the bacteria have a lot to do with obesity. The other thing is, hypothyroid is another one. People with thyroid issues have an issue with also motility, just like diabetes, and they're prone for this condition called small intestinal bacterial overgrowth. So why is SIBO so detrimental? Why is it so bad? Besides just the symptoms of bloating and indigestion, it's actually very socially disturbing. You go out on a nice date with a girl, and you're having good time, and all of a sudden you're having the dinner and you start bloating up, and you got to go to the bathroom, and you got gas. That's embarrassing. It's socially not good for somebody. It's very disturbing for somebody. But outside of the social disturbance, SIBO is bad because it causes it blunting, what they call the finger projections that you have along the lining of the small intestine. Those finger projections, they call them villi. They're the ones that help increase the absorption of nutrients. It increases the surface area, for things to get, drawn into and broken down and, into your system. So, they say that if you actually look at the absorption area of your small intestine, it's almost as big as a tennis court. So there's a lot of areas like little crypts and projections and finger-like things called villi. But because of this inflammation caused by these bacteria being overgrown, you end up having blunting. So now the fingers are stubby, they're small, and you're not getting that surface area that you need for absorption of your nutrients. And the other thing that happens a lot now is we're actually tying in SIBO, small intestinal bacterial overgrowth again, with autoimmune disorders like lupus, like rheumatoid arthritis. And the reason why that happens is that this inflammation and bacterial overgrowth in your small intestinal is causing leaky gut. So it's allowing things to get through that shouldn't get through. The best way I can explain that is like if you have a colander, for spaghetti, and it comes with the water, and only the water is supposed to go through and not the pasta. Well, over time, these colanders, the holes get bigger, and now not just the water is going through, but some of the pasta that shouldn't get through is going through. And that's what ends up happening with leaky gut. The things that shouldn't get through the small intestine are getting through, and it's going into your bloodstream, and your immune system's seeing this stuff and saying, what the hell's all this? I don't know. I'm not used to seeing these things that are not broken down and are getting through because of this leaky gut and inflammation. And then that's where your autoimmune system starts kicking in. Your immune system becomes rogue. And we talked about this in previous segments, So, and another thing that's also caused by this is, which we already talked about, it causes nutrient deficiencies, especially B vitamins, So how do we come up with diagnosis? How can we test for SIBO? Unfortunately, a lot of the commercial labs used to be offering this type of testing. It's called a SIBO breath test, or it's where you actually breathe into a bag and you get baseline levels of different gases that you breathe out after you've consumed a certain amount of lactulose, which is a type of that doesn't get absorbed, so it only stays in your GI system. And unfortunately, a lot of the gastrointestinal people, and same thing with some of the main labs like LabCorp Quest, don't actually like to do this test. It's hard to do. It's hard to get this covered by insurance or for it to actually be available. And the way it works is you basically take a baseline breath, into a bag that has a test tube that you kind of punch into the bag, and it collects your breath, And then you drink this lactulose, and it's a type of carbohydrate. It's a sugar that you start doing breath tests every 20 minutes into different bags with the test tubes, and then you can see if your levels accumulate or if they come up on the abnormal gases that you see associated with SIBO, which are going to be methane and hydrogen. So those are the two main gases that we end up picking up on breath tests. And we have a whole testing kit with all the instructions on how to do it and what you need to do before the test. You have to be fasting, not have antibiotics for like 2 weeks prior to the test, and not taking probiotics and certain fibers before the test so that the test is more accurate, So that's the part that a lot of labs, didn't have the time to go over the patients on what things they need to do before the test, and the tests were coming back false positive, false negatives. But we have a whole testing kit that you could do at the convenience of your own home, not at a lab, with all the instructions, and we have plenty of tests. So if you mess up a testing kit, we can give you another one.